There we go. Sorry. So
Good
we're joined
idea.
by Dr. Odette Suter. We're talking about chiropractic and acupuncture modalities for healing. And it's so much more than just cracking some joints and aligning some things. And you know, people hear about acupuncture and they're like, oh my gosh, needles, but it's not that at all. It's so much more involved. And so throughout the presentation, either Wendy or myself will be putting links in the chat. And I know sometimes it can be hard to multitask, but the good news is all you have to do is listen. So if you keep an eye on the chat, you'll see those links from Wendy or I that will have links to Dr. Suter's website, her international best-selling book that is designed for pet parents, and other resources that we recommend. So with that, Dr. Suter, why don't you tell us a little about how you ended up becoming a holistic veterinarian? And maybe actually we could start not only that, but just for folks who aren't aware, like not all vets are created equal, right? And
Yeah.
just because you go to vet school doesn't mean you can just automatically call yourself a holistic vet. So could you explain a little bit about that process as well?
Yeah, I mean, in the end, everybody has their own journey and their own life experience, and that leads them down a certain path. And of course, with vet school, you learn the basics, and everybody, who is a veterinarian has to have these basics. But then past that, you continue educating yourself depending or based on, what your experiences are and what kind of floats your boat, basically. So it's very individual. So there are no two vets that are created equal. Even in the conventional field, every vet is going to be a little bit different. And so
Totally agree.
if you're not happy with one vet, just go try another one. Maybe someone who resonates more with you. And I see that. And I work at a practice where there are two other holistic vets as well, and one of them is more similar to how I work, and the other one is a little bit different and has a very different personality than I do. And I don't like her clients, and she doesn't like my clients. It's like we just don't match, because her clients are more geared towards her, and they fit with her and with her approach and her personality, whereas I have others that she finds really annoying. So it's it's like friends, like family. Some people you like and some people you don't, and or you don't mesh with. So find the one that you mesh with.
Yeah, absolutely. So tell us what led you essentially to becoming a veterinarian? What was your calling?
Well, it's maybe a little bit different than most veterinarians, because most of them have a story of they brought home every sick animal they could find, every little bird that fell off the tree or whatever it may have been. For me, it wasn't really like that. I wasn't really that into animals as a child. My mom, when I was 10 years old, decided she was going to bring in a dog into the family. And my dad and I were both like, why do we need a dog? So I didn't really have a good start that way. Obviously, I loved the dog, I got to liking her after she got through her, little bitey shark teeth, baby phase. But and then it was always my sister who brought in all the stray animals and guinea pigs and you name it. And well, I ended up being the one who had to take care of them, because she just left gallivanting around the planet when she got older, and I was left with the animals. But anyway, she also dragged me into a horse barn, and that was really when things turned around for me, where I really kind of found my passion for animals and helping them and understanding them. And so that was really kind of the turning point. But I was always rather holistic, from a very young age, because we used herbs at home. We had our own organic veggie garden, and my mom was, more environmentally conscious and such. So I sort of grew up with that already, and grew up a little more unconventional because she was not in any way, shape, or form conventional, which as a kid I hated because, you just want to have a normal mom. You don't want to be embarrassed. But, later on, obviously, I grew to appreciate that because it made me who I am and
Sure.
down the path that I went down.
Excellent. And so just out of curiosity, where did you end up going to vet school?
I grew up in Switzerland, and that's where I went to vet school in Bern, in the capital.
Beautiful. Yeah. Excellent.
Mhm.
So, can you explain for folks who might not be familiar, exactly, I talked a little bit about the beginning, but from your perspective, what is a holistic vet? Like, what separates a holistic vet from a conventional vet?
So holistic means including everything. So to me, being a holistic vet means including everything that I know and also just including everything, basically, which means including what's happening in the environment, what's happening with diet, what's happening from an emotional, mental perspective, exercise, fitness, all of these things. So it really includes everything. And for me, it also includes what we call conventional medicine, because those are all tools that I have. So I want to use the tools as needed. Obviously, I will always pick a more natural approach to things. But if I see that an animal is suffering, I want to be able to alleviate that suffering so that they have a better quality of life. So to me, holistic means including everything and not, including everything, and also being open to open and flexible and not rigid, because I think you have a very rigid sort of thought and thought pattern that can happen in the holistic field as well as more of the conventional field, which is usually based more on fears that we have. So if we can be rigid and like follow something through, it helps us feel more safe in a way because we feel like we can hang on to something. But I feel like I find that as a veterinarian, it's really important to just be open and flexible, and because you have different animals in front of you, you have different people in front of you, and you have to help them find what the best solution is for them, and I don't know what that is, that's why it's so important to listen to the, to the guardians, the pet parents, they're, the people who take care of the animals and that. And the more open I can be, the more intuitive aspects come in as well, which that helps the animals as well.
Yeah, absolutely. Thank you. That was really helpful. And I will also say that in my experience as a pet parent, conventional vets rely much more heavily or even primarily on pharmaceuticals, right? And don't focus on as much on things like diet and, really, like you said, the environment and the whole picture. So, yes, I appreciate that. So thank you.
Yeah. But the thing is too, even though there's a trend towards more natural approach to things, the thinking hasn't changed.
Yeah.
And so, we used to see a symptom, so what drug can we use for that symptom? Right. Now it's changed, what supplement or herb can we use for that symptom? But that's not, to me, that's not holistic. That's still a Band-Aid approach, and is only marginally better than using drugs, because if you can't figure out what the underlying cause is and fix the foundation so that the body can function, that's what functional medicine is. You want to provide the body with what it needs and take away what it doesn't need so that it can function properly. And that requires asking the question, why is something happening? And that's the question that's usually left out. That's where logic gets lost in medicine, because naturally when we have an animal that's not feeling well, we go into panic mode. And when we're in panic, sympathetic overdrive mode, there's no logic. It just
Yeah.
goes out the window.
Yeah.
So when we do deal with animals that are sick, it's really good to have someone to help us kind of go back into more logical thinking so that we can really make a difference. Because I have seen animals that were treated with supplements for years and there was no improvement. And during that whole time, the animals were suffering.
Yeah.
We don't want that.
No.
We figure out what's going on to come up with a real plan and then make the changes and then adjust along the way, obviously, because it's not, it's never
Yeah.
simple.
Yeah, that's a great point. Thank you. So we're here to actually talk about chiropractic and acupuncture. And I think for the most part, folks have heard of chiropractic in particular, right? Mostly for humans. But and I think a lot of people, when they think about chiropractic, they mostly think about like, oh, it's good for a bad back, right?
Mhm.
Or if you tweak your neck or whatever.
Mhm.
But for those of us who have integrated these practices for our animals, we know it's a lot more than that. So would you start by giving us an overview, please, of kind of chiropractic medicine
Mhm.
and really how it benefits? Obviously, we're the Wholesome Dogs, so we're here to talk about dogs, but I'm sure you practice it on a number of animals. So yeah, so tell us more about that.
Yeah, I use it pretty much on every animal that comes to see me because it gives me some information as well of, well, it helps me to sort of determine what's going on because if after a chiropractic adjustment they're feeling better, then I know that I hit the spot. If they're not better, then I know there's probably more that I have to go dig in. So I use it a bit of like a diagnostic tool, but
Sure.
chiropractic work is really about the nervous system. It's about manipulating the nervous system because nerves are a bit like a water hose. If you step on a nerve, there's no flow. Just like with water, if you step on it, there's no water coming out. And then as soon as you take the foot off the water hose, you have water flowing again. And the same is true for nerves. So if you have compression of a nerve, and it may not be a compression that can necessarily be felt, but it can be enough to not send enough information to the muscles, the tendons, the ligaments, the internal organs, etc. And then as a result, they don't function at the level that they should. So in the case of a muscle, for example, if you end up with a muscle that's not getting enough information, it would then be a weak muscle because it's not contracting at the speed and the strength that it should. So that's one example. So for example, if you have a dog or a cat who can't jump up on the couch like it used to, or on the counter in the case of a cat, they're probably not lacking a supplement. They're probably lacking proper nerve input into the hind end. So I see that quite often. Recently, I had a patient come in with her dog. Well, she usually brings both dogs. One just comes because he doesn't want to be left alone at home. So anyway, she mentioned to me that she was going to build some stairs for the dogs to be able to get on the bed, and I'm like, well, why do you have to do that? And she said, well, that the other dog, the visitor, he was having a hard time jumping on the bed, and I'm like, well, okay, so let me have a look at him chiropractically first to see what's going on, and I found some things that are very typical that affect the sciatic nerve, which everybody I think is probably familiar with the sciatic nerve. If you've ever had someone kind of dig around your butt, massage therapist, that's kind of where the sciatic nerve goes through. So in any case, the sciatic nerve innervates most of the hind leg except for the quads, which are the muscles on the thigh, the front one. So if you have most of the muscles that are weak back there, it's harder to get up on the couch, right?
Sure.
Especially in older animals, that will be more the case than in a younger dog or cat. They will still be able to jump. So that's really important. And the reason that's important too is because these muscles back there help to stabilize the joints. They help to stabilize the hip joint, the knee joint, the tarsus, or the hock. I was looking for the layman's term, the hock, and then the toes as well. And what's the joint that gets injured very frequently? It's the knee, right? With the cruciate ligament tears. And so these muscles are stabilizing these joints. And if you have weak muscles, there's no stability. And then you can have little micro tears in the cruciate ligaments, for example, or if they step on a little bit of an uneven surface, they may injure themselves because the muscles are not responding quickly enough. Because if you're stepping on an uneven surface, your muscles are supposed to get your foot right back to where it should be so that you don't injure yourself.
Mhm.
But if that's too slow, because that has to happen in a split second, right?
Right.
But if it's too slow, then they're more likely to injure themselves. So that's really important to maintain that. And the nervous system obviously also goes through the spine. So if you have a dog who has inflammation in the spinal vertebra, the spinal joints, basically, because there are little joints between each vertebra. Let me just grab my thing real quick.
Okay. I love it. I didn't know we were going to have props, and we're going to have props. How great is that? See, you just never know what you're going to get when you sign up for one of our classes. And just a reminder, as you have questions, keep putting them in the chat. We will get to them, I promise. So, okay.
Yeah. So anyway, so this would be, well, I mean, this is the head of it's a human spine, but who cares, right? But in any case, there are little, I don't know if you guys can see it.
Yeah.
There are little joints right here between the two adjacent vertebrae. And so when these joints get inflamed because they're not moving properly, they usually get inflamed. Then we end up having a little bit of extra growth of bones. And this growth will then impinge on the spinal canal or the nerves that come out, between the vertebrae. These yellow things are the nerves, red is the blood vessel. So if we have some impingement on these nerves as an animal gets older because they have arthritis in the spine, that will then affect the nerves more permanently, because if you have a foot on the water hose that you can't take off, that's a problem. And that's why it's so important to make sure that you do regular maintenance body work. For me, it's chiropractic work, but there are other types that you can do as well to make sure you keep that mobility in the spine going properly, so that they don't end up with a spinal canal that is getting narrower and narrower, because the more narrow it gets, then the less input you have into the hind legs. And then you end up with these dogs that can't get up anymore. And it's very stressful.
That's a great point.
Yeah.
So if I could, I'm sorry, Dr. Suter, how long can damage exist, before an adjustment of a dog is really no longer effective?
Well, it will always be effective to some degree, but obviously the more advanced it is, the less effective it will be. And what happens with the spinal cord when it gets impinged, it's not just the spinal cord itself, it's also the blood supply to the spinal cord that gets compromised. And I believe that in the process, then we end up with degeneration of the spine, the nerves of the spine. And that's probably something that then continues, because in the animals that I see that already have arthritis, even though I can help them along the way, restore some function, and help them maintain, they still tend to go downhill over time. And I think it's because there's just more degeneration of the nerves happening, and nerves don't regenerate very quickly at all. And especially if the problem doesn't really go away, which is the case when it gets narrower, then there's a little bit of an issue there. But anyway, so mobility, chiropractic work is really good for mobility in general, to maintain mobility so that they can really freely move everything in their bodies. But there are definitely other things that can be helped as well, which are, for example, from a digestive tract perspective, because we have a very important nerve that comes out right by the skull, at the bottom of the skull, and then it goes along the front of the neck, underneath the neck flexors, so the muscles that help you flex the neck, and goes into the chest cavity and gives off branches to the heart and the lungs, and then it goes into the abdominal cavity through the diaphragm and into the abdominal cavity and innervates the organs there. And that nerve is called the vagus nerve.
Mhm.
I'm sure that you guys have all heard of that one. So anywhere along the pathway, that vagus nerve can be compromised and then will affect how it innervates the internal organs. So for example, if you have a dog with long toenails, it will affect the vagus nerve. And the way it does that is because when there's pain in the toes, it creates a withdrawal reflex. So basically you pull back, right? It's kind of like putting your hand on a hot plate.
Yeah.
Pull back. And in the process of pulling back, you know, if you do that, you'll feel it, right?
Right.
It will tighten the neck muscles right
Right.
here. So if the nails are too long, it will send these pain signals to the brain, and the brain just kind of goes like that, you know, sends signals back, and then you know, everything gets tight. And that then affects the nerves, the vagus nerve, which can obviously affect heart rate and heart function in the process, but also the digestive tract. And I see that quite commonly in dogs that have reflux issues. They will often have a vagus nerve that's impaired on some level somewhere along the path.
Yeah.
I just go and find where the problem is to relieve it so that they can not have that reflux, because reflux is from the well, there's a sphincter between the esophagus and the stomach. It's called the lower esophageal sphincter. And when that doesn't close properly, then you constantly have acid flowing back into the esophagus. And that acid can then also go into the throat and cause coughing.
Right.
And it can also affect the sinuses and cause nasal congestion.
Yeah.
If you have a dog with nasal congestion, it's very possible that it's because it has nails that are too long.
Wow. Okay.
So it connects everything, right?
Yeah.
What you know, true chiropractic work does is it looks at everything and you know, the practitioner understands the connections and how everything is related, and then can change it that way. Chiropractic work is not about cracking your neck like 3 times a week for like five months or something like that.
Right.
Which is, you know, something that's commonly done in humans, where, you know, they have you come in that often, and that's not chiropractic. That's just cracking neck, you know, bones. That has nothing to do with the incredible amount of fine tuning and you know, playing with the nervous system that you can do to make things work better. And for example, you know, same with that vagus nerve. I had a cat patient who, well, had kidney failure basically, and so when that cat was urinating, it was like a big puddle. And so I did a little bit of chiropractic adjustment to support the innervation to the kidneys, and the next day the urine amount was normal.
Wow.
So the thing with chiropractic work is that it can create instantaneous change.
Yeah, absolutely.
These animals come in, they have a problem, they leave, and they already feel a whole lot better, you know, and the things that they may have already resolved, like right away, which is kind of the same as with the water hose, right? You take the foot off, you have water coming right away.
Sure. That's awesome.
Yeah.
So Dr. Suter, we have a few questions, if this is a good time for me to ask a few. So the first question is from Michaela, and Michaela has a Cavalier King Charles Spaniel. And her question is, how do you choose the right chiropractor and holistic vet for your dog?
Yeah, that's a good question. And a tough one to answer as well, because again, everybody is different in what they need. I think sometimes it's a little bit of a trial and error, but you know, I would always give your, you know, holistic or chiropractic vet a chance. And I think what's also really important is to give feedback if something didn't work, because oftentimes people will not say anything because they don't want to, I don't know, upset somebody.
Right.
But if this doesn't work, you have to let your vet know. But so talk to friends, who are using someone, get feedback from them, how, what they experience. You can check the AHVMA website, American Holistic Veterinary Medical Association website. For chiropractic work, there's also the AVCA, which is the American Veterinary Chiropractic Association. They also have chiropractors. Yeah, but definitely word of mouth is always good. And then just read up on their website, what they write, what do they talk about in their blogs, what do they offer, what's their education, what are they focusing on, what is their passion, that sort of thing.
Yeah, that's great. I'm just putting links to those two websites that you just mentioned. Between Wendy and I, we're trying to put them in here right now. So
yeah. Good.
Thank you. Another question is from Chantel. Chantel says, I know small dogs are known to have issues with floating patellas or kneecaps. My Cavapoo does. One vet has recommended surgery. Another one said medication when she gets older. What is your approach to this quandary?
Yeah, that's a little bit of a tough one, because I think that these dogs with the luxating patella, they will always end up with some degree of arthritis in there, because the patella is not supposed to move around like that.
Yeah.
So I think it always depends a little bit on how affected they are by it, but I definitely see dogs where I work on their muscles to help to stabilize the knee joint a little bit more and create more comfort that way. Certainly providing them with some nutrients that are helping to support the joints would be important. And the decision between surgery and not doing surgery, that's something that has to be weighed carefully, because I've seen dogs that do well with surgery, and then I've also seen dogs that don't do as well with surgery. So it really depends, because anytime you cut into something, you create scar tissue, and scar tissue tends to shrink things up. So when you have scar tissue anywhere in the body, it can shrink up the fascia, which is basically I'm sure you guys have all had that, when you have a piece of meat and you have that very thin little white layer around it, that's really hard to, that's fascia. And that basically surrounds everything. It surrounds nerves, blood vessels, muscles, bones, organs. I mean, it surrounds everything and connects everything. So if you have scar tissue in one leg, it could affect, the TMJ on the opposite side of the head.
Right.
Far reaching, and the same is true, for spay and neuter scars and things like that.
Yeah.
You always have to weigh that. And when there's a question about that, I usually refer people to a rehab vet, because they are really good at determining and recommending one or the other approach.
Sure.
But definitely, even if you do surgery, doing some rehab afterwards would be important, just to make sure that things can be strengthened and maintained.
Yeah. So I want to jump, we're going to come back. We've got some more questions. I want to come back to the questions, because I would love for you now to just give an overview of acupuncture for animals and how that works in comparison with chiropractic medicine.
Yeah. So acupuncture also works with the nervous system and the fascia. It started about 2,500 years ago that they, started writing about acupuncture. Who knows, maybe exactly when it started, but it's been out there for a long time. And it used to be a bit more of a mystery, the whole Chinese medicine in general, and acupuncture, with the qi and the meridians and the so we do have more knowledge now, where we know that acupuncture points are in areas where there's more dense arrangement of nerves and also fascia and such. And there's definitely a lot of things that happen when we do acupuncture, such as releasing neurotransmitters to help decrease the stress level, for example. There's dopamine that gets released, which is a feel-good neurotransmitter. But it also affects hormones like oxytocin, for example. the love hormone, and it also affects nerve pathways that signal pain. So it helps with release of endorphins, which decreases pain. So acupuncture can be used in so many different ways. Again, just like chiropractic work, it can be used in so many ways. And obviously it depends a little bit on the animal, whether they tolerate it or not, but there's always ways around it. We can also use laser lights to stimulate acupoints if they don't like needles. So yeah, it can be used for all sorts of things as well, including making sure that the internal organs are working properly and such. Because the premise of Chinese medicine is that you want the qi, which is the energy of the body, to flow so that it doesn't stagnate anywhere or go in the wrong direction. Because, for example, in dogs that vomit, the energy is going upward instead of downward, for example. So that's kind of what acupuncture looks at, and Chinese medicine in general. It looks at creating like a smooth flow of that qi, because anytime it stagnates somewhere, it means that there's pain or a mass or something, so there are a lot of things that can be done. And there are also a lot of different types of acupuncture philosophies. Some acupuncturists will only use one needle for their treatment. Others a lot more. Some go more with the 5-element theory. So there are a lot of theories and philosophies within that whole Chinese medicine. There's a Japanese approach, there's a Chinese approach, there's and then there's the scientific approach.
Yeah.
So, yeah.
This is great. I'll also just say that I've had a couple different animals now that have benefited from chiropractic and acupuncture. And between the two dogs, one, the holistic vet would put the needles in her and she'd fall asleep, right? Just like she just passed out. The other one really had a hard time tolerating the traditional needles. And so she did better with the laser acupuncture, which is what you were talking about. And the reason the one that did the laser benefited from it, or we did it, was because of digestive issues. So, and we definitely saw an improvement. So yeah, I'm a big fan of it for myself and also for my animals. So, okay, so a couple other questions we have, kind of related. Jennifer would like to know what your thoughts are on kinesiology and specifically muscle testing.
Yeah, it's something I use all the time in my practice to find out where the issues are, because with muscle testing I can get the body to talk to me. I mean, there are other ways, some people are really good at palpating and feeling things. For me, I really like doing the muscle testing because I can ask very specific questions and kind of get to where the issue is, because I start somewhere with a symptom and then I work my way back to where it actually originated so that I can fix that.
Yeah. For people who aren't familiar with it, can you just give a little bit of an overview of muscle testing?
Yeah. So muscle testing is basically where we use the muscle to indicate whether there's an issue or not. So for those who are not familiar with it, I use a surrogate because, you can't really ask the animal to do that. But if you go to a chiropractor for yourself, they will use your arm, for example. So what I do is I have my surrogate stretch out their arm and then I will push on it. And if there's an issue, the arm will be more weak. And then if there's no issue, it will stay strong. So that gives me indication on where things are. And the way it works is that we all have an electromagnetic field. So the internal organs have their own electromagnetic field, and then the summation of all of it creates the bigger electromagnetic field. But if I get to an area where there's a problem, that electromagnetic field is going to be a little bit, let's just say, disturbed, not as pretty as it should be. And that then gets picked up by my surrogate's electromagnetic field too, because I'm kind of highlighting it by sticking my finger on it. And then the brain of my surrogate goes, wait a minute, what's going on here? And then
Right.
it will decrease the energy that goes into muscle. So it will decrease the body's energy. And as a result, then the muscle, the arm will be weaker. And that then tells me where, that I hit the jackpot or not.
Absolutely. Jennifer had a follow-up question, which is, should chiropractic and acupuncture be done in conjunction with one another?
I usually just do chiropractic work because that's what I'm really good at and have more training in than acupuncture. But in some animals, especially when they have more hind end weakness and such, I will also do electroacupuncture just to stimulate the nerves and the muscles as well. But I find that I get good enough results with doing chiropractic work, so I don't really feel like torturing my animal patients with
Yeah,
them.
well, and don't you think it also depends on the animal and the issue and how they respond? Yeah.
But I get, the thing is with acupuncture, it just takes longer.
Sure.
With chiropractic work, I get through it rather quickly.
Yeah.
And I find what the issues are, and then I don't really feel the need to do acupuncture on that. But for example, if I have a dog that has disc issues or anything like that, I would also do acupuncture because it helps to relax some of the muscles that may be a little spastic and such. But
Sue asks, my 2-year-old German Shepherd is very active and does not seem to have any issues at this time in his life. Do you recommend a time or age that he should be checked for adjustment? Should he be checked before issues show up? I feel like I know the answer, but I want to hear you say it. So
I know Sue knows the answer too. Right, Sue? I mean, I recommend it from the very start. I mean, the youngest animal that I've adjusted was, I believe, about a week old.
Wow.
Yeah. So that was a litter of puppies that I adjusted, and the owner told me that they slept much better afterwards. So
well, just think about it. Like the birthing process is traumatic, not just for the mother, but also, if the pup is coming out at the wrong angle or, there's so many, I mean, you know better than I do. There's so many things that could go wrong, right?
Yeah. And especially young dogs. I mean, they do all sorts of crazy things, right? So I would just get started, really early on and just start with regular adjustments, because especially in a German Shepherd, you don't want to wait until it gets too late, because as I mentioned earlier, if the spine starts to narrow down on and starts to encroach on the spinal cord, you can't really you can't really take the foot off the water hose anymore. I mean, you can make it so that you optimize it, so that you get the maximum out of it, but it's never going to be the same as if there's no encroachment on the spine.
Right.
So I recommend starting early always.
Great. Our friend Michelle Thomas, who does intuitive biofeedback work, she's also a former vet tech. She was particularly interested in the bit that you shared about the vagus nerve. And so she was wondering, are there other things that you can check for in regards to the vagus nerve and reflux beyond toenail length?
Yeah, I mean, I always check on what it is, what's where it's coming from. But if I see a dog with long toenails, that's one giveaway. If they have reflux, I will definitely also trim the nails to make sure that they don't have pain coming from there to adjust them. But I mean, all things that are innervated by the vagus nerve can be helped. And parasympathetic, basically the autonomic nervous system, which is parasympathetic and sympathetic. For example, bladder incontinence, urinary incontinence is a big one as well. That is very easy to fix with adjustments. And if it can't be fixed, then it probably is more of a hormonal issue. But I had one dog patient who, I mean, he literally, the urine was just pouring out of him. And I did 2 adjustments on him, and that was the end of him having to wear a belly band.
Wow.
Life. So I always start out with chiro, because if I can fix it with that, then I don't have to sell them a bunch of supplements and all sorts of things, and I keep it simple. So Stick to the basics, make sure that the basics are working properly. And that's why what I talk about in my book, the pillars of health is if you have the basics in place, you have the foundation, because
Absolutely.
all the supplements in the world are not going to fix a foundation that's not taken care of in the right way. I always tell people it's like you have a bunch of furniture, right? Like beautiful furniture, but you have no house to put it in.
Right.
Furniture being the supplements, right? But if you have no house.
Yeah. And I think, I don't know, maybe I'm hanging out with the wrong people, but I don't know a lot of pet parents who are independently wealthy. And, I know that the thing that I go to my holistic vet the most for is the chiropractic adjustment. Because so often it solves whatever the problem is, right? And it really is the definition of a quick fix, right? It's like,
I know.
Adjust and they're done.
In holistic medicine, it's like you don't really want to talk about quick fix, but it really is. It really is. Yeah, you're right. I mean, even dogs that are humping excessively, I've fixed with chiropractic work until they're off again. But it's like stop being crazy. Instead of just chopping off their goods.
Right. Right. Well, and especially with all that is coming out, even in the last year, about the long-term effects of the traditional spay and neuter, right? And what that does to the body. And now, we have some of us, depending on where we live, have other options like ovary sparing sprays and right, and vasectomy versus just like a full neuter. So I think we have to do another session on that, but we actually had a follow-up question from Michelle. So Michelle asks, she goes, in Vermont, we don't seem to have very many veterinary chiropractors available. Do you think it is safe to bring your dog to a human chiropractor who feels comfortable adjusting pets?
Yeah, I mean, there are a lot of human chiropractors that are trained as animal chiropractors as well. So I would definitely find out if they have some training. I think that probably would be better because, you want to make sure that they know a little bit about the anatomy of the animals. I mean, there is a little bit of a difference there, they stand on 4 legs instead of 2.
Sure.
So it's a little bit different, but yeah, definitely. I mean, if somebody is trained in chiropractic work, certainly.
Yeah, I know my vet here, my chiropractor, not my dog's, he works on dogs and horses. So, and I've known several like human chiropractors who especially do equine work, right, with the horses. So, yeah. Great. Another follow-up question. Ashley asks, I have a 5-month-old lab named Goose who has neurological issues in his spine. They affect his back leg, walking wise, and a specialist suggested chiropractic and physical therapy. The chiropractor I saw said she could or couldn't help him. I think she couldn't help him is what she meant to say.
Yeah, I'm not sure. The face doesn't really go with the text.
Yeah. So maybe Ashley can clarify it. We'll give Ashley a chance to follow up so we can clarify that. Couldn't help him. The chiropractor said she couldn't help him. Do you think maybe she should try getting a second opinion from another veterinary? Okay.
Yeah, I would. Yeah. But it certainly is possible. And then also check in with a rehab vet, because rehab vets are really good with these types of things, and they use a lot of different modalities as well. Plus they can help with training the brain. I don't know exactly what kind of neurologic issue it is. Suspecting maybe wobblers possibly. So they can help with strengthening muscles to create more stability and do whatever else is needed. So they have a wide arsenal of tools that they can use to help out and such.
Great.
Yeah.
Jennifer has another question. Her question is cold laser therapy the same thing as acupuncture?
No. Acupuncture generally is just sticking a needle into different acupoints. Cold laser therapy is more is broader. I mean, we can use laser lights that have a more narrow light to activate these acupoints, but laser therapy is a little bit different in that it provides, or it brings energy into the tissues so that they can heal or have less pain and have better blood circulation and all of that. So it's not classified as the same modality. It's a different modality, but we can use laser to activate acupuncture points.
Got it. Okay, thank you. Another question is, how do you, this is a great one. I'm dying to know this. How do you adjust a cat?
Well, the same way as you adjust a dog or a horse. I mean, you may have to be quicker because they may not tolerate it as well. But you know, so are dogs sometimes. I just visited my sister this weekend and tried to adjust her dog, and he tried to eat me.
I was going to say that's really why I was asking, is because having had cats, I know cats versus dogs in terms of, you know, they're very much, they want to be touched on their own terms. So
yeah,
you know.
yeah, and you have to kind of listen to that as well, and because animals are really smart, you have to listen to them because they give you
100%.
feedback. They're more in tune with their bodies, and you know, if an animal doesn't like something, then take note of that, because maybe it's just something that really is a problem for them and they don't like it. You know, I have a German patient, for example, who he was getting, well, he has a lot of mobility issues, and he was getting massage at another place because I don't do massage, and he doesn't particularly like it. So I asked the owner, well, if he doesn't like it, why are you doing it? And are you seeing any benefit? You know, I mean, if you're not seeing any benefit,
Right.
obviously, then it may not be the modality to use, because you don't want to waste your money either. But of course, if you have a healthy animal, you're not going to necessarily see a big difference after an adjustment, but I would still do it on a regular basis because you're kind of keeping things fine-tuned, you know?
Yeah.
So, yeah. Yeah, but yeah, cats usually, I mean, they don't hate it generally, I find.
Right. It's funny because just before you gave that example, I was about to ask you, but I think you inadvertently answered my question, which is if you practice Tui Na, which is a form of like myofascial massage. Is that anything that you're trained in or you incorporate?
No, I use visceral manipulation, which is, well, it works on the fascia and also on the internal organs to move things around. Because as I mentioned, scar tissues, for example, they cause tension. So then once it's healed properly, you want to help to kind of release some of these fibers again so that things can move better. But there can be tension in the fascia just from living, you know, for example, if your GI tract is a little bit off, you know, that can then radiate into the back, for example, and cause back pain. I had one Great Dane dog that I worked on. I knew her since she was a year old or something like that, but they had moved away a little further and I hadn't seen her in a while. And the owner said that she's always panting a lot, and then she burps and, you know, sits up and then she burps, you know, looks really uncomfortable. And then once she has burped, she feels better and then she lies down again, and then it would just keep going. And they had tried Gas X and all sorts of other things. And so I saw her for some chiropractic work, and that just helped marginally. She was feeling a little bit better, so I had her come back and I did some visceral manipulation. And what I felt was that her whole abdomen, I mean, the part that's right below or, you know, right by the diaphragm was really stuck. Like it was like one big clump. And she's a dog who had gastropexy, where they attach the stomach to the wall so that it can't flip.
Right.
In any case, nothing was moving in there. And so I started mobilizing things, and obviously once the stomach is attached, it's never going to move within that space the way it could, but still I got a lot more mobility in that whole area so that it released that kind of clump. And the owner went home, and 20 minutes later I get a text with a really nasty looking picture of vomit with a pair of socks in it. So she had a pair of socks in her stomach for weeks.
Oh my gosh.
So mobilizing all of that restored nerve input into the area, and then probably strengthened the wall of the stomach,
Oh,
and be able to actually expel it. So
can you imagine how uncomfortable that poor dog must have been? Oh,
yeah, yeah. So
oh,
anyway, so there's so much that can be done. And, you know, if you could do all sorts of tests to try to figure out why there's gas, and try all sorts of probiotics and
sure.
prebiotics and whatever other supplement, but the socks would not have dissolved.
Yeah,
You know, they would still have been there and potentially caused an obstruction, you know, I
an
mean,
obstruction, right? Oh my,
yeah,
it could have been deadly.
yeah.
Like,
Well,
oh
yeah,
my
I mean,
goodness.
might have required surgery, but
Yeah. Well,
okay, that was that, you know, so.
oof. Okay. Well, on that note, I want to just if we can, Dr. Suter, I'd like to screen share and show your website. And then while we're looking at your website, I'd love for you to talk about your masterclass if you're willing to.
Yeah, sure.
Great. All right. So here's your website. And first of all, you have to tell us about this hat.
Yeah, well, I started wearing that one because, well, I don't know. I like having fun, I guess.
Yes, yes. But that is a poop emoji hat. Is that correct?
Yeah, it is. It is. And then people started to call me the poop lady, so that's how I got my title, I guess.
I love it. I love it. By
Yeah.
chance, okay, really random question. Were you at Super Zoo?
This year, you mean?
Yeah. Yeah.
Yeah. Mm-hmm.
Were you at the animal biome? Okay,
Yeah.
because I was like, God, she looks just like the woman that I talked to at the animal biome exhibit because
Yeah.
you had the poop hat on. Okay, we have met. All right, that's so
Yeah.
fun.
Yeah, and various other clothing. Yeah, but I think I've maxed myself out. I don't think I can get any more out there with it.
That's amazing. Okay, I love that so much. Well, we're big animal biome fans, and we promote it and we talk about it quite a bit because
Yeah.
we are big believers. So
Yeah.
thank
So
you.
am
Okay, all right. So now let's talk about you.
I. Yeah, yeah. So basically, on my website, what you can find is just more information on gut health, because that seems to be like a huge problem these days. A lot of animals have gut issues, and we know that all disease begins in the gut. So I'm focusing a bit more on gut health in my approach,
Mhm.
because, well, that's a little bit what I'm known for, because I do deal with a lot of gut issues with animals. So my website is a big geared to that. I have a free master class for you guys to watch, where I talk about the 7 pillars of health, and especially as it relates to the gut.
Mhm.
So you can watch that for free. And then I also offer a holistic health program that is also, focusing a lot on the gut, but on pretty much everything else as well, where I basically help support pet parents, no matter where they are in the world, to provide them with really good foundational education, and then help them transform their animals' health. We do weekly live calls where we talk about the animals in depth, the individual animals. So it's like having a holistic veterinarian at your fingertips, all the time, and getting help. And, we come up with plan of action, what kind of diagnostics, what kind of treatment. I talk about a lot of the, lab results, how to so that people understand those. And it's basically really to empower people, but
Mhm.
it's also about helping to bridge the gap between veterinarians and pet parents, because veterinarians just don't have enough time in the day to be able to educate pet parents as much as would be needed.
Yeah.
So I help out with that, just to kind of take a little bit of the weight off of veterinarians, so that they can have a little bit more, not feel as overwhelmed, because I answer any questions that come up, kind of food when they have diarrhea and things like that. So it takes a little bit of the load off of veterinarians who are out in practice.
Yeah. Yeah, that's amazing. And I can tell you, for everyone at home, this is not the norm. And this is like truly a gift. So definitely take advantage of this.
Yeah.
Because
Yeah.
this is not the norm. And you know, if you've listened or been part of any of our classes here, you know, you've heard me talk time and time again. It's not the conventional vet's fault, right? Especially here in North America, conventional vets, when they go to those first 3 to 4 years of vet school, only get about a semester's worth of nutrition, and it's not, and they have to learn about the nutritional needs of 8 or 9 companion animals, right? Everything from horses to rodents to, yes, cats and dogs, but also I think birds are covered in there, and that's a lot.
Fish.
And how do
You have to
you,
learn about fish and bees.
right? And like, how do you, how are we to expect that our
Yeah.
vets can truly understand the nutritional needs if they're only getting like a semester and only part of that dedicated to a dog or a cat, right?
Yeah.
So
Yeah, there's so much information that has to be covered.
correct.
There's
Correct.
just there's not enough time. I mean, the curriculum should really be longer, but
Absolutely. Yeah. But anyway, that's a
yeah.
vent for another time. So so to have access to someone of Dr. Suter's accreditation and experience is really, really amazing. And I want to thank you, because this is truly like a gift, and
You.
I want to
Thanks
share
for
it from the
recognizing it.
rooftops. Yeah, well, no, it takes a
Yeah.
lot of work. And it takes Wendy and I a lot of work just to put the wholesome dog on. And, you know, yes, we have day jobs, but to do this on top of your clinical practice, I know that must be a tremendous undertaking. So
Yeah, but it's very rewarding, you know, and people in
sure.
my group, in my program, they all know each other. And so there's a real community that's happening, and they feel more relaxed because they have the support, you know, so it brings
Yeah.
down the stress level, and, you know, they feel better, their animals feel better.
Yeah. That's
So
great.
it's really amazing. Yeah, we have a lot of fun. And I do have a, a deal going right now to help out pet parents. So I have a $600 discount on my program until
Wow.
the 15th. So you have to have signed up by the 15th of December to
Okay.
get that. So just wanted to put it out there.
Okay. And it's still probably cheaper than a couple vet visits with a bunch of labs and stuff like that. So even if it seems like a lot, just think about your last vet bill. Right.
Yeah, well, you know, a lot of people who come to me, they've already spent thousands of dollars, and they still don't have an answer and still don't have the results that they're looking for. So
Right.
this program really provides that support and that transformation, and they benefit from my experience, of course, and it can be done from anywhere in the world.
Yeah.
And it's ongoing, so you know you have access to me for the life of the program, which I'm planning on doing for a number of years. So if you start adding up vet bills and vet consults and the hassle of not being able to reach your vet because they're too busy, etc., you know, that all adds up to the level of stress as well. So,
Well, it's working, because I'll tell you, Michaela just messaged me and said that she just signed up for the masterclass and she's thinking of using holistic approaches for her dog. So you've already won a couple of us over. So well done.
yeah, well, that's good. That's good. Yeah, because you know we want to be proactive. We all want to have a good life with our animals, and
Sure.
and I also, you know, one of my big goals is too, because it's not the veterinarians who are going to change how animals are being treated and helped, you know, from a healing perspective. It's the pet parents. So if I can empower pet parents, then they vote with their money, and then that will push the veterinary community to move and start to integrate more of the holistic approaches and such. So I basically say that I'm creating troublemakers.
I love it. I love it. I'm all for more troublemakers. So
yeah, in a kind way, obviously.
yes,
You know,
obviously.
right.
So and so Dr. Suter, tell us a little bit about the book for those who are interested.
So my book basically goes over the foundational pieces that are necessary for the animals to be able to be healthy. In general, I'm not one to beat around the bush, and I also am a minimalist. I wouldn't necessarily say that I'm lazy, but I like to kind of get a lot for my effort.
Sure.
minimal, so
Sure.
minimal effort, maximum benefit. So I don't fuss around with a lot of a ton of supplements and things like that. I go to the root of things. I
Yeah.
want to figure out how I can fix that, and then, create a really good foundation so that the body can sort of run itself with that foundational support. So,
Excellent.
and that's what my book is about.
Awesome. And
Mhm.
I'm guessing it's a little bit at $9.95. I'm guessing it's a little cheaper than your masterclass or your
Yeah,
program.
but it
Yes.
also obviously doesn't give you any of the in-person support
Sure.
or any of that.
Sure. Of
And
course.
it's
Of
it's
course.
obviously much more superficial as far as the information. I mean,
Sure.
my program is definitely much more in depth
Yeah.
and
Of
such, but
course.
it's a good start,
That's great.
to read, and it's a easy read. People tell me that it's a really easy read. They read it in a couple hours, and they really, I've gotten some good feedback on it. So
Great.
really
Well,
nice.
speaking of recommendations, I will tell you that I'm going to stop sharing here and then I'll bring it back up. But your we already so we want to brag a little bit that you are listed on our website as a health and behavioral professional that we recommend to follow.
Oh,
So,
thank you.
if you go to our website, and I'll just show you what that looks like so folks can find it, and I'm going to ask Wendy to put the link on the page. But if you go to the Wholesome Dog and you go to the resources page, you can click on health and behavioral professionals, and there you are on there along with some other folks and there's your doggy biome. I know we share many of the same philosophies around food and nutrition. So
Yeah.
we just really appreciate that.
Mm-hmm.
Let me just see if there's any last questions from folks. I know we're around time, and again, we so appreciate you giving your time this evening. It means a lot to us. Is there any last thoughts you want to leave us with, Dr. Suter?
Yeah, well, thank you everyone for being here and for having me. I really appreciate that. It's always a pleasure because I thrive. That's my passion, is to educate. Last thought, trust your gut. Okay, well, that was an obvious pun.
But a
Yeah,
good one. But a good one.
yeah, trust your intuition and breathe. Don't forget to breathe, because
Yeah.
I find that people in general in this world these days have a lot of anxiety going on. And so breathing is really, really important to just relax again and not get dragged down the path of anxiety and
Yeah.
freaking out and all that, because that doesn't help the animals either. So whenever you feel yourself going into more anxiety, panic mode because there's something going on with your animal, breathe and ask for help.
Yep. Absolutely. I feel like that is such simple information, but also so overlooked sometimes. I'm really good at giving advice to other pet parents and have a hard time following my own advice sometimes, especially about breathing, right?
You're only human. Same here. I mean,
Thank you.
I just said that to myself.
Yes. But yeah, so thank you so much. So we are gonna we have recorded this. We will put up on our YouTube channel. Dr. Suter, I have to confer with Wendy, but if I have anything to say about it, we would love to find an excuse to have you back.
I would love that.
So if you have another topic you're dying to talk about, like, give us a call. We wanna have you first.
Gut health. I'm always up for gut health.
Listen, as someone who themselves has Crohn's disease and my dog has gut issues, I am all about gut health. We love talking about gut health. In fact, one of the things, just we'll give a little teaser to everyone that's here. We're planning some really exciting content for the first 3 months of the new year. And we're actually thinking about doing a series, a multi-part series about gut health. So maybe, Dr. Suter, if we play our cards straight, we could rope you in for a small part of that. I think that might be pretty awesome.
Would love that. I would love that. I mean, I've done a lot of research this year especially around the microbiome, because I was doing some lectures at the AHVMA conference.
Mhm.
So I have a lot to share.
Oh my gosh. All right. Well, let's have everyone hop off and you and I can talk for another 2 hours at least. No, I'm kidding. But
Yeah,
that's
yeah,
excellent. Great.
definitely.
Well, thank you so much. And thank you everyone for joining us. We will have more classes we'll announce, including, I believe, in February, we're going to be doing a whole series on cancer. And both from an energetics, an herbal perspective, nutrition perspective, and one of my favorite topics, the endocannabinoid system, and talking about adaptogens and things like that. So stay tuned. You are officially already on our email list. The only way you can get off is if you unsubscribe, but this means that you'll get an email as soon as we launch those classes. And hopefully we can work something out with Dr. Suter and have her back. So
Yeah.
thank you so much,
thank
Dr.
you.
Suter, and thank you
Thank
everyone,
you
and
all.
have a wonderful evening.
Yeah, bye-bye.
Take care.
You too. Thanks.